Good morning. My name is Jamie Dudensing, and I'm the CEO of the Texas Association of Health Plans. THP would like to express our support for Senate Bill 1592, which would increase accountability for freestanding ERs. Freestanding ERs have become a very big concern of ours in the Texas marketplace. We're now home to more than 200 independent freestanding ERs, which is over 50% of the nation's population of freestanding ERs. We're also seeing 12% cost growth in emergency care as a result of them, and huge increases in cost per visit and utilization, which is driving up cost of health care. Additionally, one of our bigger concerns is how they are representing themselves to patients. Whether or not they're telling a patient they're in or out of network, we commonly see on their websites, and when a consumer enters a freestanding ER, they will use the terms, "We accept all insurance," including Blue Cross Blue Shield, Aetna, United, Cigna, when in fact they're not in network for any single health insurance plan. While consumers may choose to go to a freestanding ER, we just think it's important that they be held accountable to being upfront and honest with consumers for the fact that they are a freestanding ER, whether or not they are in network or out of network, and what they're going to be charging consumers. And often consumers leave and receive a bill later on in thousands of dollars, often surprising them. This bill would increase the penalty to $25,000, which I think is fair in that it will align with the penalty that hospital ERs have and hospital freestanding ERs have, that will match up with Senator Swartner's other bill around hospital accountability. And I would love to take any questions that you have.
I have a question. So I'm trying to understand your testimony. The penalties would be for what? For whether they're representing they're in or out of network?
It would read in regards to all of their regulatory requirements that it happens at Department of State Health Services for their licensure. So right now they are required to post that they are an ER, that they are an ER, that they charge similar to ER fees. And there are other bills going through that would be at this session that would be adding regulatory requirements around how transparent they are about their network status.
So, okay, I get what you mentioned. I think the first thing you said was the costs of healthcare are going up, and I'm just trying to understand what does that have to do with the bill, though? Aren't we just trying to make sure that freestanding ERs are held liable to the same standard as hospital-based ERs?
That's correct, sir.
Okay. So what does that have to do with the cost of healthcare going up?
I think if consumers are more accurately informed, and if there's better signage, and that the freestanding ERs are doing what they're supposed to be doing, most consumers report to us that they would not have chosen an out-of-network independent freestanding ER. They would have chosen an urgent care facility instead. And
then they're going to be sanctioned? There's a possible sanction for that?
No, there's only a penalty on if they're not following their regulatory requirements that are part of their licensure, which is the same as a hospital ER not following their regulatory requirements as part of their licensure.
Are there any other questions? Senator Cole first.
I just, back when I chaired public health on the House side, I passed a bill that made them have a sign. I mean, before it was very ambiguous. No one knew that they were going into a freestanding ER. They thought they were going into urgent care. And so, Mr. Chairman, I was walking in. We're all laying out bills and have different committees going on at this point. The goal of your 1592, if you were going to give me one sentence, what is?
To increase the regulatory penalty cap for violations and align it with hospital emergency rooms. If they want to say they're an ER, they should also have the fee and penalty structure as a hospital-based ER.
I agree. I'm not sure that taps down the cost that we're seeing, and I do know that, Jamie, your testimony was a little, like Vice Chair Uresti says, on controlling cost. I do think that the consumer is confused in that they don't know, if they accept their insurance or not. They end up with a balance bill. It's very large. We see ERS and TRS wrestling with cost drivers that we saw in our work groups that we were looking at healthcare control costs. I'm going to challenge this group right here to say, it was under my watch as chair of public health that we passed the legislation. The proliferation I never dreamed would happen. And now we have freestanding ERs, and now we have hospitals that had ERs having freestanding ERs because they have to compete with the other ERs. And when the question is always this, Mr. Chairman, doesn't competition lower price? It doesn't when no one knows what the prices are and when you're not paying. When a third-party payer, and this has always been my complaint about healthcare, is that somebody else is paying, so the only thing that I'm worried about is my copay at this point. And so the challenge being, and I know we're nipping at the edge, but the real question to all of us is that have freestanding ERs, both from traditional hospitals that now have freestanding ERs and other for-profits and private equity that have come into the state, and we have more than half in the United States right here. They seemingly go to affluent areas. It's not like they're going to the areas that we have we used to call food desert, where we have deserts of no healthcare providers. And I'm just challenged by it being a cost driver. I appreciate you bringing the bill forward. Of course, we should have the same penalties if they're acting as ERs. But I think the question becomes for all of us is how they service the public good, and is there transparency, as Jamie mentioned, and are we getting good health results for the cost that it is?
Any other questions?
I would agree with you completely, sir.
Thank you.
Thank you.